How do blood bone markers explain bone formation? Imagine a busy construction site where new buildings are constantly being built and old ones are being renovated. Your bones work in a similar way, constantly remodeling through a balance of building and breaking down. Blood bone markers are like the construction signals that tell us how active this process is. They are substances released into your bloodstream during bone formation, giving us a window into how your osteoblasts, the cells responsible for building new bone, are working. One of the main markers is called procollagen type I enteropeptide, or P1NP. When osteoblasts produce type I collagen, which makes up most of your bone matrix, P1NP is released as a byproduct. Because collagen is the main protein in bone, higher levels of P1NP in the blood usually mean more new bone is being formed. Another similar marker is procollagen type I C-propeptide, or P1CP, which also comes from collagen production. Clinicians often prefer measuring P1NP because it is more stable and less affected by other hormones, making it a reliable indicator of how actively your bones are forming. Bone-specific alkaline phosphatase, or BAP, is another key marker. Osteoblasts produce BAP during the mineralization phase of bone formation. It helps in the process by breaking down pyrophosphate, a substance that inhibits mineral deposits. When BAP levels are high in your blood, it suggests your osteoblasts are actively mineralizing new bone tissue. While total alkaline phosphatase can come from other parts of your body like your liver, the bone-specific version gives a clearer picture of bone activity. Osteocalcin is a protein secreted by osteoblasts during bone formation. It gets incorporated into the bone matrix but also circulates in the blood. Measuring osteocalcin can give clues about osteoblast activity, but it's less commonly used because it can degrade quickly and vary a lot between individuals. Bone remodeling is a finely tuned process involving both osteoclasts, which break down old bone, and osteoblasts, which build new bone. Blood bone formation markers focus on the activity of osteoblasts and the creation of new bone matrix. When doctors measure these markers, they get a snapshot of how fast new bone is being made. This is especially useful in conditions like osteoporosis, where the balance of bone remodeling is disrupted. In osteoporosis treatment, these markers help monitor how well therapies are working. For example, drugs that stimulate bone growth, called anabolic treatments, tend to increase P1NP levels early on, showing that osteoblasts are more active. On the other hand, medications that slow down bone loss, known as antiresorptives, usually decrease these markers, indicating a slowdown in overall bone turnover. In summary, blood bone markers are like biochemical reporters of osteoblast activity and new bone production. They help us understand the dynamic process of bone remodeling, assist in diagnosing bone diseases, and guide treatment decisions. Always remember, if you have concerns about your bone health, consult a healthcare professional who can interpret these markers in the context of your overall health and medical history.